Hi, good morning, everyone. First of all, I'm going to say I'm incredibly honored to be here. And this is the first International Parkinson's Empowerment Summit. I think that's tremendous. I think it's really innovative. What I'm going to try to do in my talk is give you a kind of overview of the 5 elements that I've taken from the Move for Parkinson's Foundation, and I've used them to help me think about some of the tools that you can avail yourselves of to help you live better right now. So let's get started. First thing I want to say is that choosing the right tool for the right job is key. So we're going to be looking through a lot of different possibilities, but not all of these are going to be right for everyone. Not all of these are going to be right for the same kind of job. One example that you already probably know about is that we're going to talk a little bit about medications in my talk, and then you're going to hear a lot more about medications later on. And you probably know medicines can help with many of the aspects of Parkinson's, but there's some things like balance that they're not so good for helping with, and that's really where you need a different tool. So things like exercise, Tai Chi, all sorts of different options are available there, and that's an example of getting the right tool for the right job. And then I think in my practice I see this, there's so much variability between different people with Parkinson's, even though we talk about Parkinson's as if it's one single entity. So I just want to make it clear at the outset, I'm going to be talking about a lot of different tools here, but everyone is different, everybody's different, everybody is different, actually. So finding the things that are right for you is going to be key in living well right now. So what's in the toolkit? For people who know more about the Move for Parkinson's Foundation, you'll be familiar with the 5 elements, so here we go. We're going to be talking about, quick overview here, medication awareness and medical support. And you're going to be hearing more about that in one of the presentations later this morning. We're going to be talking about nutrition, exercise, of course. We're going to be talking about emotional well-being, because I think that's an area where we're not always as sensitive as we should be. We don't always take care of ourselves emotionally. We're not always as good about taking care of that. And then we're going to come back to the optional treatments, and there's a whole range of optional and complementary treatments that are out there that can help different aspects of Parkinson's disease. So I'm going to launch right in. Let's start talking a little bit about the first element, medication awareness, okay? So I don't need to tell people in this room, Parkinson's medicines are complex. You already know that. I just want to give you a little bit of background. So there was a survey, just some examples, a survey of about 500 people with Parkinson's disease, just counting the number of pills that they took every day. And they found on average people were taking 8 or 9 pills a day. I find it difficult if I have to take antibiotics, 3 tablets a day. So I appreciate the complexity of managing that, and yet it is so important. One of the things that I took away from this study, actually, was that the people who were interviewed who had Parkinson's said, sure, the number of pills I take every day is a burden. But you know what? When they asked the doctors, it was a lower priority for them. And I think this is one example that you can take away where your doctors may not always realize what we're putting you through, what we're asking you to do. This is something you can bring up. And it's a great example of where a little bit of knowledge, knowing to ask the question, is going to empower you and help you. Again, it's a tool to help you work with your team. Let's dig a little bit more into the complexity of taking medications for Parkinson's. There was a study back in 2010 where they asked people about taking their pills, and they found almost, more than half of people were not taking the pills exactly as prescribed. And I think this, again, is where you can bring it up with your healthcare team. When you go into the office and you're talking about your symptoms, you're talking about the medicines, don't forget to bring up if this is difficult to deal with. Because if you don't take the medicines correctly, first of all, they may not work as well. And the second thing is, you may actually end up with your doctor making decisions based on what they have as wrong information. So just an example, there was a study where they looked at almost 800 people from a database with Parkinson's disease. This is where they got the number that about 60% are not taking the medicines exactly in the way that their doctors thought. And these are some of the problems that came up. Of course, the more complex your regimen is, the more difficult it is to deal with. If you don't know so much about your medicine, it's harder to deal with. That was actually one of the factors that came up in people who didn't know so much about the medicine. They were less likely to take it in the right way. Depression, I think, I had never thought that depression would affect people taking their medicine the right way, but in retrospect, of course, it's obvious. And so this is something that the study found that I think really taught me a lesson in my clinic. Forgetfulness, of course, and I know, for example, my patients always tell me, even if I'm just asking them to take medicine like Sinemet, the carbidopa-levodopa, 3 times a day, it's lunchtime, you're supposed to take your medicine, you get out, you get busy, of course you forget. So all of these are things that we need to think about, that we need to be aware of. You're not going to get it right all the time, I don't think anyone can, but this is definitely an area where you can try and you can communicate with your healthcare team. And one of the things that I would say is that as time goes by, we're getting away from medicines where you have to take them multiple times a day. There are more and more options that are coming out now that are just once a day. So it is actually possible sometimes to cut down the number of pills, simplify the medicines that you're taking. And that's definitely something where, again, if you know about that, you can ask. You can ask the questions of your doctor and get yourself onto an easier schedule sometimes. So I would say, knowing about your medicine, knowing how it works, not the intricacies, not the details, but knowing a little bit of the basics about how the medicine works for your Parkinson's, I think that's a great resource. It's a great tool. It helps you partner with your team. It helps you partner with your support team, with your medical support team as well. And I think it's really important to know what are the pros and cons of the medicines that you take. What are you expecting them to do for you? And if they're not doing that, why are you taking them? It's another great question for your doctor. And what are the side effects to look out for? I think one of the worst things I come across in my clinic is that my patients are so loyal and so good. I might give them a medication. They go away, they take it, they come back a couple of months later, and they say, well, I haven't had such a good appetite. My stomach doesn't feel good. And I just would rather them know that that's a potential side effect up front so that they know to give me a buzz, give me a call, say, hey, you gave me this medicine. It's giving me side effects. What's going on? So I think knowing a little bit, doesn't have to be a lot, but knowing the basics about the medicine is really empowering, really helps. And we're going to talk more about this in a minute, getting the most out of your medicines. But I think one of the things that we try to do in the office is make sure that we've got the best medicine and the best timing. And timing, there's a slide on this in a second, might be that when what you're eating at your meal times, it might be that that's actually interfering with your medicine getting absorbed. So it can be all sorts of things that you don't always think of. Does the medicine last until the next dose is due? That's another place where, with a little bit of information, you can take that to your care team. They can help you out with that. And are some doses hard to remember? Are some doses inconvenient? What might seem convenient for someone may not be for another. Your doctor may not know. So I would say bring all these things up. And what I'm going to finish with for this section is an action item. So you'll see for every one of these 5 elements from the Move for Parkinson's brochure, we're going to look at a little bit of background, but then one action item. The action items are not going to be for everyone, but if you can take one thing home from this talk that helps you, I will be very satisfied. So the big action item on medication awareness is keep an updated list of your medicine. Keep it with you, keep it in your wallet, keep it in your purse. That way, if you have questions when you're going into your healthcare provider, if you're going to your doctor, your nurse, whatsoever, you've got that list at your fingertips. You don't even need to think about it. So what I'm going to do now, we talked a little about medicine. You'll hear more about that later, as I said. Let's look at nutrition, and I put a couple of what I think are really pretty pictures up here. And we all know that we should eat healthily. We all know a healthy, balanced diet. It's important for Parkinson's. And as you heard earlier, there's more research going on into some of these non-medication tools that you can use to help you with your Parkinson's. You heard about exercise earlier and how that might be protective. But a lot of people think that there are certain foods or certain diets, certain styles of eating that can help with Parkinson's. And in fact, I would say even more extensive than that. Not just Parkinson's, probably great for healthy brain aging. So we should all be thinking of that. So when I'm talking about foods that have been associated with healthy brain, healthy aging of the brain, we're talking about really delicious things now. We're talking about berries, we're talking about colorful foods, fruits, vegetables. There's a great paper that came out linking red peppers and other vegetables that are in that family with a lower risk of Parkinson's. Now, the most data that's come out actually concerns the Mediterranean diet, and that's why I have this beautiful picture right here. This is actually where I used to work. I worked for a year in the south of France, and that was right outside our lab. But the food that you get around the Mediterranean, you know this style, right? It's beautiful, fresh vegetables, fresh fruits. We might not be on the Mediterranean here, and I think we know that from the rain outside, but we can certainly take a leaf out of their book in terms of our food choices. So, I want to talk now, before we conclude on this section, about diet and Parkinson's specifically. So I already said that some people think the food choices you make can be beneficial for Parkinson's overall. But then there's some other things that I know none of us are so good at some of these things, like staying hydrated. We need water. They say 8 glasses of water a day. How many of us actually get that? I know when I'm at work and I'm running around, I often just forget to drink. I try to have my tea all day long, and that's really important to stay hydrated, but you just don't always make it. And staying well hydrated, it's important for general health. Helps avoid constipation, and we'll come back to that in a second, because, Parkinson's, it slows down the movements, but it slows down the bowels as well. And constipation is just uncomfortable. So staying hydrated really helps with that. And another symptom that some people get, not everyone with Parkinson's, is that lightheadedness, if you stand up quickly. And that can be a symptom of Parkinson's, and it can be a side effect of the medicines as well. So staying hydrated really helps to counteract that. I mentioned constipation. We know fiber in the diet. That's not rocket science. Fiber in the diet can help with constipation. And one question that I get a lot in my clinic is, what sort of supplements or what sort of vitamins should I be taking? And you probably know, or many of you know, that there have been a lot of studies trying to look at, should you supplement? Should you take extra vitamin E? Should you take extra vitamin C? And I think if you took all of the vitamins and the supplements that you read about on the internet, you'd be sitting with a great big plate piled high with vitamins and supplements and no room for anything else like our beautiful Mediterranean food. So I think if you're going to do that, picking and choosing is really the key. Just a couple of things I wanted to bring up, though, that are pretty new. There are a few studies recently that brought up that people with Parkinson's seem a little bit more likely than the general population to have a vitamin D deficiency. So that's something that we sometimes check, because vitamin D, it's really essential to bone health. The other thing that came up a few times in several studies, people with Parkinson's are a little bit more likely to have a deficiency in vitamin B12. And vitamin B12, it's important for brain health, it's important for memory, and it's important for how you walk and your balance and your peripheral nerve function. So those are a couple of things where there's a lot of research going on. We don't understand the links right now, but I would say watch this space, because that may be an area where we're starting to do a little more testing and get a little more aggressive about giving people supplements in the future. And I just wanted to mention these diet interactions with medicine. So we all know protein's good, protein's essential. Protein, you need it to build your muscles, right, and maintain your strength. Now, it turns out this can be kind of tricky for some people with Parkinson's disease. And the reason is it has to do with the levodopa that's in your Cinemet, the levodopa that's in your carbidopa-levodopa. And a little bit of an anatomy picture here, so I'm just going to point out. When you take your levodopa, mouth somewhere up there, you swallow it, it comes down to your stomach, which is right, I have to jump, but it's right here. And it goes from the stomach into the small intestine, which is all this just feet and feet and feet of small intestine. The only reason I point that out is it's so important for absorbing your levodopa. So that's where the levodopa goes in. It's also where protein goes in. When protein's broken down by the enzymes in the stomach and it gets into the small intestine and gets broken down some more, that's where the protein gets absorbed. And unfortunately, the two of them actually will compete. The levodopa in your medicine and the protein in your food compete. So if you have a lot of protein in your meals, the levodopa doesn't get in so easily. Now, I would never say follow a low-protein diet, and a lot of my patients, especially with early Parkinson's, they don't really need to bother too much about the timing and the meals and thinking about what's there in the food that might interfere with the medicine absorption. But if you're someone who finds that one of your doses in the day doesn't work very well, like maybe a lunchtime dose doesn't work well, you might just want to take a look and take a look at the timing of the medicine. Like if you have a big protein lunch, like a burger or some nice cheese or something, and then you take your medicine after that, it may be that the food interferes with the medicine kicking in. So again, example of where a little bit of knowledge can really help you to improve how your medicines are working in Parkinson's. I would also say, watch out for weight loss. It doesn't happen to everyone, but a few people do get weight loss, and Parkinson's can cause loss of appetite in a lot of people. You know, you lose your sense of smell, or some people do, or you feel full very quickly after eating even a small amount. So weight loss is pretty common, actually, in people with Parkinson's. And although we always think weight loss is good, being underweight is just as bad as being overweight. And I just want to finish this section with a couple of words about Parkinson's and bone health. I already mentioned your vitamin D is so important for bone health. And attention to good bone health is critical, especially if you're someone who tends to be a little off balance. If you're at risk of falling, you want to have strong bones. So we talked about the vitamin D, but you're going to see this crop up over and over again. Exercise is just so important. And weight-bearing exercise, actually, lots of exercise can really help you maintain strong bones. So here's the nutrition action item. And I would say just treat yourself. Have some nice fresh fruits, some nice fresh vegetables every day. You'll get your vitamins out of them. You'll get the fiber out of them. It's just healthy all around and helps promote healthy aging of the brain. Now, exercise, and you're going to be hearing a ton about this today. This is really the big one. Exercise kind of does it all. You've heard that already, right? It improves movement. We know that. It improves balance. It helps with posture. It just helps open you up. It helps with mood. It helps with thinking, thought processing. And, as you heard earlier, there's some great research going on now that exercise actually protects the brain. This is incredible. Exercise, it's been shown in studies, will help the brain to produce its own protective substances. So exercise is great. This is actually a picture of our yoga class that we started when I first went to Weill Cornell. And we held that class just across the street from me. It was just absolutely a great, great class and a lot of fun. We met some really great people there. And what sort of exercise is best? Well, I don't think there's any right or wrong, basically. You see here a lovely picture of our good friend David Leventhal, who's teaching in Dance for Parkinson's. You'll hear from him a little later. You'll see an aspiring Davis Phinney here. It's kind of poor style, but I was trying. So cycling, resistance training, Tai Chi, dance. I should have put exercising the voice, because we're doing a lot of that today. This is all good. And this Tai Chi, I just wanted to give you an example, because this was actually a study that was published in one of the major medical journals. It improves movement, it improves balance, and it reduced the risk of falls in a pretty big, very carefully done study. And recently, there was a study where they asked patients what they thought of it, and they said, positive health benefits. And actually the great thing was people tended to continue. So this, I think it's an example. If you like something, you feel like you're getting something out of it, you'll do it, you'll continue with it. So I want to encourage everyone to exercise. So this is my action item here. Just go do the exercise, do anything. I think it's important if you enjoy the exercise. So lying down and breathing, love that. Stretching, relaxing, pedaling, dancing, singing, rowing is great. Running if you can, skipping, upside down, that would be yoga, right side up. Talking, chatting, reading, playing. Playing music is great when you exercise, it really is. And then I just wanted to make one important point. If you're out there and you're exercising and you're tiring your muscles, rest. And this is a great picture of animals. Animals know how to relax and rest so much better than we do, and we should follow them. So I'm going to finish with the last couple of sections. First of all, I did want to bring up emotional well-being. These unseen symptoms of Parkinson's, we sometimes don't always recognize them. We may not recognize them in ourselves. We may just think that we're feeling irritable or stressed out. We may not recognize them in our loved ones or our colleagues or our friends. So insomnia and sleep problems, we'll come to that in a second. Depression and anxiety can happen with anyone. You don't have to have Parkinson's to have that. But if it happens and you've got Parkinson's, it's really doubly important to recognize it. Hallucinations can happen as a medicine side effect. If that comes up, let your doctor know. That's a big one. Changes in behavior can happen. Again, can be a result of medicine side effects. And memory problems and confusion can be from the medicines, can be from Parkinson's, but it can be from the medicines. So it's really important to recognize these things and go and ask for help. So let's just mention sleep, because Parkinson's is not great in terms of sleep. It affects sleep in so many different ways. It causes sleep fragmentation, causes insomnia. People get restless leg syndrome. People get this thing called REM sleep disorder, where you might shout or you might act out your dreams, which is okay, except it disturbs the person next to you. And if you're really acting out some wild dreams, you might hurt yourself. People get stiffness or get some tremors at night. That might mean you need a change in your medication. And what about urinary frequency? Getting up to go to the bathroom a bunch of times in the night, that disturbs your sleep as well. So you can ask your medical team about getting some tips and whether there are any treatments that you should be looking at for sleep problems. But I just wanted to show you a beautiful picture of my husband who's volunteering somewhere. This was when I was giving a talk at a conference down in Florida, and there he is. He's got it down. This is how we should sleep. Mood changes. We know Parkinson's can affect the mood. We don't always recognize it, but it can cause lack of energy. It can cause change in appetite. You'll see some of these things go with Parkinson's anyway, not always depression. That makes it very hard to recognize when these things are going on. You can feel low, you can feel irritable. We talked about problems sleeping. Well, that can happen with depression as well. So really, these are things when they happen, you can start to dig into these a little bit. And this is where a little bit of knowledge can really help. And I think the first step is recognize the problem. And for a lot of us, we don't want always to accept that we're depressed. We might not want to accept that someone we love is depressed, but it can be treated. That's the great thing. Talking therapy, cognitive behavioral therapy, and medications can be really helpful. And as I mentioned before, exercise can really help lift the mood. So here's my action item for emotional well-being, and I would say be open. Be open to identifying and looking for treatment for depression and for other non-movement related symptoms. Okay, last section, you're going to be hearing so much about various what are called optional treatments, but I would say some of these are not optional. I mean, some of these are really well established and well needed by many people with Parkinson's. And I'm talking about things like speech therapy, getting your voice going. Expression is so important. You need to be heard. Occupational therapy can be so incredibly helpful. Physical therapy. Physical therapists can target their therapy to match the needs of the person who they're treating. This section also includes some things that are complementary, and a lot of my patients get a lot of benefit from acupuncture, especially for pain and stiffness around the shoulders, or massage therapy can help with things like that. And then some of the other, and I included this as an optional treatment here because we always say it's elective, but there's a breakout session on surgery later on. So some of the optional treatments are actually a lot more invasive, and we're going to be hearing a lot more about surgery in the coming years. So I would say, just harking back to how I started, just keep an open mind and see what's right for you. This is really an area where it's not one size fits all. It really is the case where every body is different. Everyone can benefit from different things in different ways, but it's worth trying. So just to summarize, I would say putting together a toolkit to help you live well right now, it'll help empower you. Learning about Parkinson's helps empower you. It helps you take charge. It helps you live your life well. And get your whole team working with you. This is a place where you really want to have a team around you. And your team can have a wide range of specialists, and your team includes people who love you, people who take care of you, people who see you every day. But I would say in terms of your medical team, take notes and ask questions, be proactive, get us working for you. So here's my final summary of the 5 action items that I'm going to suggest. And again, if you can find just one thing here that you can adopt, go with it, I'll be happy. So keep an updated list of your medication. Keep it with you at all times. Eat healthy, fresh fruits and veg every day. It really does your brain a favor. And exercise, I put breathe, bike, play, but you saw that whole list, really fun things that you can do. I'd say in terms of the non-movement symptoms of Parkinson's, be aggressive in looking out for those non-motor symptoms, including depression and the other unseen symptoms. And then finally, keep an open mind, see what's best for you, ask those around you, help's out there, and we're going to move on to a movement break. So thank you very much for your attention. Again, I'm delighted to be here.